Question number 1. Which type of seizure involves both hemispheres of the brain? The correct option is D. Generalized seizures. Question number 2. Which protein accumulates in Alzheimer's disease? The correct option is C. Beta amyloid. Question number 3. Which lobe of the brain controls voluntary movements? The correct option is A. Frontal lobe. Question number 4. The blood-brain barrier is primarily formed by. The correct option is B. Astrocytes. Question number 5. Which the neurotransmitter associated with pain modulation is? The correct option is C. Substance P. Question number 6. Which cranial nerve is responsible for the gag reflex? The correct option is D. Cranial nerve 10. Question number 7. Parkinson's disease is characterized by which type of tremors? The correct option is B. Resting tremor. Question number 8. Locked in syndrome result from damage to the. The correct option is A. Brain stem. Question number 9. Which neurotransmitter is inhibitory in the CNS? The correct option is C. GABA. Question number 10. Which type of seizure involves a brief loss of awareness? The correct option is A. Absence seizures. Question number 11. Which neurotransmitter is primarily responsible for muscle movement? The correct option is C. Acetylcholine. Question number 12. What is the hallmark sign of a basilar skull fracture? The correct option is A. Bettle's sign. Question number 13. Which cranial nerve is responsible for hearing? The correct option is C. Cranial nerve 8. Question number 14. Which part of the brain is responsible for memory formation? The correct option is D. Hippocampus. Question number 15. The parasympathetic nervous system mainly releases. The correct option is B. Acetylcholine. Question number 16. Which nerve is compressed in carpal tunnel syndrome? The correct option is C. Medial nerve. Question number 17. Which cranial nerve controls pupil contraction? The correct option is B. Cranial nerve 3. Question number 18. Which area of the brain is responsible for language comprehension? The correct option is D. Rinke's area. Question number 19. Which cranial nerve is affected in Bell's palsy? The correct option is B. Cranial nerve 7. Question number 20. Which condition is associated with claw hand deformity? The correct option is a ulnar nerve palsy. Question number 21. Which test is used to diagnose myasthenia gravis? The correct option is A. Tansalin test. Question number 22. Which test measures electrical activity of the brain? The correct option is D. EEG, electroencephalogram. Question number 23. The main excitatory neurotransmitter in the brain is? The correct option is C. Glutamate. Question number 24. The reticular activating system is responsible for? The correct option is D. Sleep-wake cycle. Question number 25. The spinal cord ends at which vertebral level in adults? The correct option is B. L1 to L2. Question number 26. Which vitamin deficiency is associated with Urinki's encephalopathy? The correct option is A. Vitamin B1. Question number 27. Which test is most useful for diagnosing epilepsy? The correct option is C. EEG. Question number 28. The primary visual cortex is located in the? The correct option is C. Occipital lobe. Question number 29. Which area of the brain is responsible for emotional regulation? The correct option is B. Amygdala. Question number 30. Which part of the spinal cord carries motor signals? The correct option is D. Ventral horns. Question number 31. Which lab test is abnormal in bacterial meningitis? The correct option is B. High protein.